Can you explain what cancer actually is? Like what's happening in the body when someone gets cancer?
Great question. And first off, I want to thank you for asking these questions and bringing this to your platform because you're not the only one who doesn't know this information. And I say if people just understood some of the basics about cancer, I think a lot of the myths and misconceptions wouldn't be out there.
Yeah.
Right.
I
So,
feel like people use the word cancer like many people use the word metabolism. They say like, oh, I have a slow metabolism. I'm like, well, what's metabolism? And they have no idea. And I'm guilty of like, I have no idea. Like I hear cancer and I hear it can proliferate and I hear there's malignant and benign. But I don't know what is actually happening in the body
yeah.
when someone gets cancer. Like,
Yeah.
what is it?
Yeah. You have people saying that cancer is a parasite. That is not happening. It's not some foreign thing. It was a single cell in your body that had mutations to the DNA that allowed it a growth advantage. And then it began to grow more. And then it was able to acquire more mutations. And then we see like the selective growth of a cell that has acquired mutations to continue to proliferate. And we call the hallmarks of cancer are these other characteristics that these cells have to acquire to continue to grow. Right? Because after a while, they're going to lose their blood supply and they're not going to be able to proliferate, right? So they actually can create their own blood supply, right? Inflammation is a way that it can promote its own proliferation. It has altered metabolism, so it's able to generate a lot of energy very quickly. These are rapidly dividing cells. Also, something we see in cancer cells is that they can evade our immune system. Our immune system is looking for damaged cells, trying to take care of them. They're able to evade the immune system. So we see that it all starts from one cell. That's all it takes. So cancer is not one disease. It's an umbrella term for over 100 different diseases because any cell in your body could become cancerous. Right? And then it depends on what other mutations it acquires to determine its invasiveness, its ability to respond to treatments as well. So simply put, it's genetic mutation of a single cell. So it's not a foreign body that came in. There's no worms involved in it. It's like I've heard some wild things out there. But I think what's really wild is that it's our own DNA. Like these are
Yeah.
all the capabilities that our body has. We have the ability to create blood vessels, but only at certain times should we be doing that, right? And so it's actually using our own DNA to create cells that take over.
And so is that why, for example, if the body detects there's something wrong, we'll see white blood cell increase to try and fight it off, but it can't. So if someone's getting their blood work done, you see elevated white blood cells is potentially an indicator of a cancer?
Unfortunately, no, that's not a great indicator.
Really? Okay.
Yeah.
So tell me what is a good indicator?
Unfortunately, we don't have great screenings for most of our cancers, right, to be able to detect this. So our signs and symptoms for cancer are usually very vague, like
Okay.
unexplained fatigue, right? You might have pain in an area. Rarely is it a big palpable mass that someone's able to feel. I mean, with breast cancer, some people are able to feel that, but that's why mammography is so important because it can detect these masses before they're palpable. Or a colonoscopy could maybe detect something early, but we don't have like a universal blood test. Now, that is something that's in the works to look for what they call circulating tumor DNA. So little pieces of the cancer cell, and that could be detected. But we don't have great screening. So unless you feel like something is wrong, but when there are vague symptoms like fatigue, it's like, well, how have you been
Right.
sleeping, right? Are you stressed more? And I think that's why, well, I know that's why we see delayed diagnoses. Because there can be a lot of vague symptoms, and unless you're looking in the right area at the right time, you might miss seeing someone's cancer. So very rarely are we able to use blood work alone to be able to detect if someone has cancer. A blood cancer, you'd be able to look at blood work, but
So how do you, and this is going to seem like such a stupid question, I can't believe I'm asking it, but like let's say someone has cancer, they just get a typical blood panel and they see white blood cell count is elevated. What would they do next in order to say like, hey, we need to figure out if you have cancer? Like, what do you do next?
well, with a white blood cell count that's elevated, it would depend on how elevated it is, because sometimes a white blood cell count that's elevated, you have an infection.
Right.
Versus maybe a white blood cell count that's really elevated could potentially be leukemia.
Okay.
Right. But it's not going to be elevated because of breast cancer or
Oh, it
prostate
won't be.
cancer. No.
Okay. And so the way someone would find out about breast cancer, prostate cancer, breast cancer is maybe they feel it. Prostate cancer, they have the symptoms of fatigue. How would they get this diagnosis then that they have it?
It would require imaging, typically.
Okay.
Imaging, or if there is some type of palpable mass, like sometimes in lymphoma, they may have a enlarged lymph node, and they can biopsy that and then see if that was cancerous. But it requires imaging, and that can take a long time to get done.
Right.
And that's why they usually, and be expensive, so that's why they try to rule out some other things before. For example, colorectal cancer, especially in young adults, we see delayed diagnosis. Like, oh, you're young, right? You're healthy.
Right.
Maybe it's IBS. You're stressed. You haven't been eating well. Until they get a colonoscopy, are you able to tell if there's something in there? Yeah.
So that's something I struggle with because my brain goes, I want to try and figure this out. I want to rule out the worst case scenario as soon as possible. But it seems like the medical system goes the other way. Like, let's go we'll just assume the least benign first. And obviously every cancer will be different, I would imagine. But let's say it's delayed a month, 3 months, 6 months, a year. Can cancer rapidly progress over that time? So people are potentially going from an early stage treatable cancer to a late stage non-treatable cancer because of these delays by the medical system?
Yes, absolutely.
Well, that's scary.
That can occur. It is. And that's part of, we see these health disparities in survival rates, or health disparities in that they tend to be diagnosed later, some different races. And that could be because of the way that they're treated in the medical system, and delays, and then you're diagnosed at a later stage, which is going to have poor survival outcomes, right? And so, yes, that's why I always advocate for people to advocate for themselves. If something feels off, you know your body better than anybody. And to tell your doctor these new symptoms, what you've tried, what you've done. I've told my patients, like, go in there with your list of what you've done, what you've tried, what you've ruled out yourself, so that you can get the next needed thing. Because there is going to be sometimes some delay. So you do have to advocate for
and
yourself.
You say push for imaging, push so that you can try and get this as quickly as possible?
Especially, so kind of colorectal cancer, we had kind of talked about this briefly, but we're seeing a rise in young adults in colorectal cancer.
Yep.
And so there's blood in your stool. That's not normal.
Yep.
Don't assume it's hemorrhoids. Like, let them know about these symptoms. I think sometimes too, these symptoms can be embarrassing to talk about, right? Like, oh, for prostate cancer, maybe increase in urinary frequency or inability to have an erection. You've got to talk about that with your doctor. Some people are a little hesitant. It's like, they're there to help you. So, tell them all these symptoms and advocate for these things. Don't assume it's normal.
Okay. That's all super helpful. And later on, I want to talk about the rise in cancer in young adults. I think it's something I'm personally very interested in. My next question is, why do some people get cancer when they live a very healthy lifestyle? And then we see other stories of people who they smoke and they drink and they don't work out and they're centenarians. They lived over 100. Like, why do some people get cancer and others don't?
I know. $1 million question.
Do we have? There's no answer to it.
I mean, really, we know that right now. We say only 10% of cancers are genetic, in that there was an inherited mutation.
Only 10%.
Yes. So the rest is, we say, to environment and lifestyle, which is a big thing to try to explain. And say, okay, we only know of 10% as far as known genetic mutations. There could be more as we are able to do more genetic screenings on people that have cancer. So we know, and I often hear this from patients too, is like, I did everything.
Yeah.
I did everything, right? I've had the vegan marathon runner, slept, yoga, stress management, and still got cancer. It's like, we don't know. We don't know why some get it versus the other. What you did lowered your risk, but something else caused that damage. And it doesn't mean that these behaviors aren't important. We just need to understand their limitations and that there's still a lot of unknowns in cancer. It doesn't mean that we don't know anything and that people are trying to know and understand. So some people take it one way of, well, then what's the point?
Right.
Let me just drink, smoke, do whatever I want. Versus others, I see it as, let me do everything that's within my control.
Yeah.
Because we also know in the research that those that are healthier at diagnosis have better survival outcomes. They're going to be able to withstand their treatments better, have less treatment side effects. So it's still important.